Welcome to our video presentation on other medical terminologies and abbreviations related to the skeleton. The world of medicine is filled with specialized language and abbreviations that help healthcare professionals communicate effectively. In this video, we'll dive into the fascinating realm of medical terminology specifically related to the skeletal system. The skeleton is not just about bones. It is a complex and vital part of our bodies. Understanding the terminology associated with it is crucial for healthcare professionals, medical students, and anyone interested in the intricacies of human anatomy. Throughout this presentation, we'll explore key terms and abbreviations that you may encounter when dealing with skeletal issues, orthopedics, or related medical fields. Whether you're a medical student, a healthcare provider, or simply someone curious about the language of medicine, you're in the right place. By the end of this video, you'll have a better grasp of these terms and how they relate to the amazing framework that supports our bodies and enables our movements. So let's embark on this educational journey as we decode the language of the skeleton. We'll cover terms like arthrochalasia, osteoporosis, tibia, humerus, and many more, shedding light on the terminology that healthcare experts use every day. We are the Group 2 and we're excited to be your guide on this exploration of other medical terminologies and abbreviations related to skeleton. So let's get started. To start, we have allograft, graft of tissue between individuals of the same species but different genetic makeup. Homograft, all allogeneic graft. An allograft is a type of tissue graft that involves the transplantation of tissue from one individual to another individual of the same species but with different genetic makeup. The term allo means other or different, so allografts involve the use of tissue from a genetically different donor within the same species. Allografts are commonly used in various medical procedures, including organ transplants, skin grafts, and bone grafts. Allografts are advantageous because they allow for the transplantation of essential tissues or organs when autografts are not feasible, or when there's a lack of suitable donor tissues. However, since the donor and recipient have different genetic profiles, there is a risk of immune rejection, which occurs when the recipient's immune system recognizes the transplanted tissue as a foreign or mounts an immune response to reject it. To mitigate this risk, immunosuppressive drugs are often administered to transplant recipients to suppress the immune response and improve the chances of graft acceptance. Um, a related term to allograft is homograph. A homograph is essentially another word for an allograft. It refers to the same process of transplanting tissue from a genetically different donor of the same species. So homograph and allograft are often used interchangeably. In summary, allograft and allograft and homograph, you can explain that an allograft is a tissue graft involving the transfer of tissue from one individual to another of the same species but with different genetic makeup. This can be a life-saving procedure but requires careful management of the immune response to ensure graft survival. You can also mention that homograft is a synonym for allograft and can be used interchangeably to describe this type of tissue transplantation. Next is we have arthrochalasia, surgical breaking of an ankylosed joint to provide movement. Let's elaborate on the term arthrochalasia. Arthrochalasia is a medical term that refers to a surgical procedure involving the intentional breaking or manipulation of an ankylosed joint in order to restore or improve its range of motion. An ankylosed joint is one that has become stiff and immobile due to various factors such as injury, disease, or degeneration of the joint. Arthrochalasia is typically performed when conservative treatments such as physical therapy or medications have been ineffective in improving joint mobility. Here's a more detailed explanation of the key aspects of arthrochalasia. Arthrochalasia is considered when a joint is severely restricted in its movement, causing significant pain and functional impairment. It is often used in cases where other treatments have failed, and the individual's quality of life is significantly affected by the immobility of the joint. During an articulation procedure, the surgeon carefully breaks or manipulates the adhesions or scar tissue that have caused the joint to become ankylosed. This is typically done through a surgical approach, and when the exact technique may vary depending on the joint involved. The goal is to release the joint and improve its range of motion. Another arthrochalasia rehabilitation is a crucial part of the recovery process. Physical therapy and exercises are often prescribed to help the patient regain strength and mobility in the joint. The patient may need to use assistive devices or braces during the recovery period. The risks and considerations. So, orthoplegia is not without risks, and when the decision to undergo this procedure is made after careful consideration of the potential benefits and complications, there is a risk of complications such as infection, nerve damage, and recurrence of joint stiffness. For the alternative treatments, before considering arthrochalasia, less invasive treatments are usually explored. This can include anti-inflammatory medications, joint injections, and physical therapy. Therapy. If these methods do not yield satisfactory results, surgery may be considered. In summary, arthrochalasia is a surgical procedure performed to break or manipulate an ankylosed joint to restore or improve its range of motion. It is typically considered when other treatments have proven ineffective in addressing joint stiffness and immobility. The decision to undergo arthrochalasia is carefully weighed, um, taking into account potential risks and expected benefits of improved joint function. Post-surgery rehabilitation is essential to optimize the outcome and regain functional use of the joint. Third is we have aspiration. Removal by suction as removal of fluid from body cavity, also inhalation such as accidental inhalation of material into the respiratory tract. So to elaborate aspirations, which has two distinct medical meanings. Aspirations as removal by suction. In the medical context, aspiration refers to the process of removing fluid or other substances from a body cavity using suction. This is commonly used in procedures such as aspirations of excess fluid from the chest or abdomen. It can be therapeutic, aiding in the removal of unwanted substances to relieve pressure or discomfort. For example, a physician may perform thoracentesis to aspirate fluid from the pleural cavity in the chest. Next is we have aspiration as inhalation. Aspiration can also refer to the accidental inhalation of materials into the respiratory tract. This can happen when foreign objects such as food or fluids are inhaled into the airways rather, instead of going down the esophagus into the stomach. Aspiration, in the sense, can lead to respiratory problems and in severe cases, pneumonia or lung damage. So, here's a bit more detailed on each meaning. So, in aspiration as removal by suction, this medical technique is used to remove excessive fluids or other substances that shouldn't be present in a body cavity. It's commonly performed under sterile conditions with the use of needle and syringe or a suction device. Aspiration can help in diagnosing certain conditions, relieving pressure, or facilitating the collection of specific fluids for analysis. Next is we have aspirations as inhalations. Accidental aspirations of foreign materials into the respiratory tract is a concern, particularly in vulnerable populations like infants and the elderly. Aspirated substances can lead to breathing difficulties and may require medical intervention to prevent complications. This can occur during swallowing, especially in cases of dysphagia, difficulty of swallowing, or when the protective mechanisms that prevent aspirations are, impaired. In summary, aspirations has two distinct medical meanings. One involves the removal of substances by suction from the body cavities, and the other pertains to the unintentional inhalation of foreign materials into the respiratory tract. Both meanings are critical in the medical field, with the former being a useful technique in various procedures and the latter representing a potential health risk from foreign materials are inhaled into airways.
Greetings everyone, I'm Althea Marie Balisi, a BSN 1F Group 2. I'm going to tackle about autograph, chondroitin, and glucosamine. So what is autograph? Autograph is a graft of tissue taken from a site on or in the body of the person receiving the graft or autologous graft. According to medical news today, a bone autograft involves repairing bone with material from a person's own body. Surgeons can take tissue from a person's cancellous or spongy bone, cortical or compact bone, or bone marrow. According to a review in a journal of orthopedic trauma, autograft is the gold standard in treating trauma-related conditions, including fractures and delayed healing or non-healing of bone breaks. However, it is not suitable for everyone. Which is better, allograft or autograft? Allograft and autografts each have their own advantages and disadvantages. The type of graft that is more suitable for a person depends on their unique circumstances. Overall research suggests that autografts offer better long-term outcomes. One small study in the American Journal of Sports Medicine found that at least 10 years after anterior cruciate ligament surgery, more than 80% of young athletic people still had intact and stable grafts. However, the failure rate was more than 3 times higher for allograft than for autografts. Similarly, a 2016 review from a meta-analysis found that having an autograft significantly decreased chances of problems developing in people having anterior cruciate. Ligament reconstruction, rather, factors when choosing autograft: no chance of rejection, no chance of disease transmission, faster incorporation into the body, lower cost, lower availability, potential donor site complications. So now let's move on to chondroitin. So what is chondroitin? A complex polysaccharides found in connective tissue used as dietary supplement, usually with glucosamine for treatment of joint pain. According to Mount Sinai, chondroitin is a molecule that occurs naturally in the body. It is a major component of cartilage, the tough connective tissue that cushions the joints. Commercial chondroitins come from natural sources, such as shark, bovine cartilage, or synthetic production. Chondroitin helps keep cartilage healthy by absorbing fluid or particularly water. In the connective tissue, it may also block enzymes that break down cartilage, and it provides building blocks for the body to produce new cartilage. A number of scientific studies suggest that chondroitin may be an effective treatment for osteoarthritis or OA. An osteoarthritis is a type of arthritis characterized by the breakdown and eventual loss of cartilage, either due to injury or normal wear and tear. It commonly occurs as people age. In some studies, chondroitin supplements have decreased pain of osteoarthritis. Not all studies are positive, though, and several have not shown any beneficial effect from taking chondroitin. It is not clear why the studies have different findings, and experts disagree on whether chondroitin is helpful in treating osteoarthritis. In the past, some researchers thought chondroitin may actually slow progression of the disease. Unlike other current medical treatments for osteoarthritis, many people take either acetaminophen or non-steroidal anti-inflammatory drugs such as ibuprofen and naproxen for osteoarthritis pain. So far, studies have not shown conclusively that chondroitin helps repair or grow new cartilage or stops cartilage from being further damaged. Chondroitin is often taken with glucosamine. Another supplement that has been studied along with chondroitin for osteoarthritis rather. Like chondroitin, glucosamine also has conflicting results. Treatment of the osteoarthritis. Results from several well-designed scientific studies suggest that chondroitin supplements may be effective treatment for osteoarthritis, particularly osteoarthritis of the knee or hip. Though one recent review of several studies found no benefits from use of chondroitin alone. In general, findings from these studies suggest that chondroitin reduces osteoarthritis pain, improves functional status of people with hip or knee osteoarthritis, reduces swelling or stiffness, provides reliefs from osteoarthritis symptoms for up to 3 months after treatment is stopped. Lastly, the glucosamine. Glucosamine is a dietary supplement used in the treatment of joint pain. What is glucosamine? Glucosamine, what is it? Glucosamine is naturally occurring in our bodies. It is an amino sugar compound which is a combination of natural chemicals. The substance is found in our bodies within our joint fluid and cartilage. It also occurs in some animal bones, fungi, and shellfish. What is glucosamine good for? Glucosamine used by our bodies to build and repair cartilage, tendons, ligaments, and the synovial fluid around our joints. What is glucosamine good for is supporting healthy joints, bones, cartilage, muscles, tendons, and ligaments. Is glucosamine good for joints? Yes. Glucosamine is good for joints. Glucosamine helps support healthy joints, bones, cartilage, and muscles, tendons, and ligaments. Are glucosamine supplements safe? Yes. Glucosamine supplements safe, that is providing that they are from a reputable brand as a Beeline Healthier that use the best quality ingredients, provide the recommended daily dose, and that your doctor says it is safe for you to take a supplement. What foods are high in glucosamine? While found in the shell or shellfish, there are no natural sources of glucosamine in food. Supplements are a dietary source of glucosamine. Why take glucosamine supplements? As we grow older, the production of glucosamine slows down. Also, while we exercise, joints experience additional wear and tear. This can lead to damage and degeneration of our joints and bones. Glucosamine supplements are used to help support joint and bone health and fight age-related health conditions including osteoarthritis. What does glucosamine do for the body? There are lots of positive side effects for the body. The health benefits of glucosamine are the 13 benefits of glucosamine. Number 1, health maintains healthy joints and bones. Glucosamine is essential for maintaining joint mobility and flexibility. Number 2, enables the body to make chemicals that build and repair cartilage, tendons, ligaments, and the synovial fluid around joints. 3, decreases joint pain and arthritis pain. 4, reduces inflammation in the body. 5, may help treat osteoarthritis by reducing pain and improving function. 6, lowers the risk of a number of chronic conditions. 7, HCl helps cartilage and synovial fluid regeneration. Glucosamine HCl decreases symptoms of joint degenerative illness. 9, helps treat interstitial cystitis, which is a chronic condition that causes bladder pressure and pain. 10, potentially reducing inflammation associated with inflammatory bowel disease. 11, may help relieve pain and inflammation associated with temporomandibular joint or TMJ disorders. 12, a 2012 University of California Irvine study featured in the Journal of Biological Chemistry states that supplements may help suppress multiple sclerosis attacks. 13, may improve knee mobility. A 2007 study of male athletes that suffered an acute knee injury showed significant improvement in knee flexion and extension with glucosamine supplementation. That would be all. Thank you.
So today, I will be discussing three topics, which are goniometer, iontophoresis, and laminectomy. So let's start off by goniometer. A goniometer is a measuring instrument used to quantify angles or rotations, and it finds applications in various fields including physics, engineering, medicine, and geometry. The term goniometer is often used interchangeably with protractor, although goniometers can be more precise and versatile. Goniometers typically consist a semicircular or circular scale with degree markings and an indicator that can be rotated to measure the angle. In the medical field, goniometers are commonly employed for assessing joint mobility and range of motion. Physical therapists and medical professionals use them to measure the angles of the joints, helping diagnose and monitor conditions like arthritis, injuries, or post-surgical recovery. In summary, goniometers are versatile tools used for measuring angles and rotations in various fields, from physics and engineering to medicine and education. Their adaptability and precision make them valuable instruments for a wide range of applications, aiding in accurate measurements and analysis. And for iontophoresis is a non-invasive medical technique that uses a low-level electrical current to deliver drugs and therapeutic agents through skin. It is commonly used in physical therapy, sports medicine, and dermatology for various purposes. Iontophoresis works by applying a small, direct current to the skin using specialized electrodes or pads, driving charged ions through the skin barrier, facilitating their absorption into underlying tissues. It is considered a less invasive and more precise method compared to traditional injections or oral medications, and is generally considered safe when performed by trained professionals. However, it may not be suitable for all medications or conditions. In conclusion, iontophoresis is a valuable therapeutic technique that allows for controlled, localized drug delivery to the skin. It is widely used in the fields of physical therapy, dermatology, and sports medicine to manage the range of medical conditions while minimizing the risks associated with systematic drug administration. And for laminectomy, laminectomy is a surgical procedure that removes the lamina, a part of the vertebral bone, to relieve pressure on the spinal cord or nerves. It is recommended for conditions like spinal stenosis, herniated discs, tumors, or spinal injuries. The primary goal is to alleviate pain and improve function by creating more space in the spinal canal. Recovery time varies depending on the surgery and patient's factors. Laminectomy can provide short-term relief from pain and neurological symptoms, but long-term effects include potential spine stability. In summary, laminectomy is a surgical procedure performed to relieve pressure on the spinal cord or nerves by removing a portion of a vertebral lamina. It is a common treatment for various spinal conditions but should be considered carefully, weighing the potential benefits against the long-term effects and the need for spinal stability. It is typically recommended when conservative treatments have not provided sufficient relief from spinal-related symptoms.
Thank you very much, Elish. Now I'm going to discuss the meniscectomy, myelogram, and the osteoplasty. But before that, let me introduce myself first. I am Kenshin Baawa from Group 2. What meniscectomy is the removal of the crescent-shaped cartilage or the meniscus of the knee joint. It is a type of surgery that's used to treat a damaged meniscus. What is meniscus? A meniscus is a structure made of cartilage that helps your knee work properly. You have two of them in each knee. The lateral meniscus, found near the outer edge of your knee joint, and the medial meniscus near the edge on the inside of your knee. Your menisci help your knee joint function by distributing your weight over a larger area, which helps your knee hold up your weight and stabilizing the joint, providing lubrication, sending your brain signals so you know where your knee is in space relative to the ground, which helps with balance, and acting as a shock absorber. A total meniscectomy refers to surgical removal of the entire meniscus. Partial meniscectomy refers to removal of only the damaged part. Why is it done? A meniscectomy is a typical performed when you have a torn meniscus, which is a common knee injury. About 66 out of every 100,000 people tear a meniscus per year. The goal of the surgery is to remove fragments of the meniscus that stick out into the joint. These fragments can interfere with joint movement and cause your knee to lock. Minor tears can often heal on their own without surgery, but more severe tears often require surgical repair. Surgery is always needed when a tear doesn't heal with conservative treatment such as rest or ice. Your knee joint goes out of alignment. Your knee becomes locked. When surgery is required, whether you'll need a partial or full meniscectomy depends on your age, your size, tear location, cause of the tear, your symptoms, your activity level. How is it done? There are two main approaches used for a meniscectomy. Arthroscopic surgery is usually done using spinal or general anesthesia as an outpatient surgery, meaning you can go home the same day as the surgery. Open surgery requires a general or spinal anesthesia and possibly a hospital stay. When possible, arthroscopic surgery is preferred because it causes less muscle and tissue damage and leads to a quicker recovery. However, sometimes the tear pattern, location, or severity makes open surgery necessary. Next is a myelogram. What is myelogram? Myelogram is a diagnostic imaging test generally done by a radiologist. It uses a contrast dye and x-rays or computed tomography or CT to look for problems in the spinal canal. Problems can develop in the spinal cord, nerve roots, and other tissues. This test is also called myelography. The contrast dye is injected into the spinal column before the procedure. The contrast dye appears on an X-ray screen, allowing the radiologist to see the spinal cord and other nearby structures more clearly than with standard. A healthcare providers might recommend this if you have a chronic back pain. A regular spine X-ray gives a clear picture of just your bones because it doesn't use contrast material. The contrast material providers used in a myelogram shows up white on an X-ray or computed tomography scan, giving a detailed view of your spinal canal. Myelography is a type of fluoroscopy, which means your radiologist can see the contrast material moving through your spinal column in real time. Why would a doctor order a myelogram? If you have chronic back pain, your healthcare provider will likely suggest either a computed tomography scan or MRI, the magnetic resonance imaging first. If neither test can explain the tissue, your provider may recommend a myelogram to get more information. A myelogram can help diagnose conditions like herniated bulging discs, arthritis in your spinal joints, spinal stenosis when the spaces in your spine narrow and press on your spinal cord, and the bone spurs, or osteophytes. What are the side effects of a myelogram? Up to 10% of people experience side effects after a myelogram. Normal side effects that go away in a day or two include headaches and nausea and vomiting. Call your healthcare provider immediately if you develop a headache that doesn't go away or other worrisome symptoms like fever, stiff neck, and tingling in your legs. Next is a osteoplasty. Osteoplasty is a surgery performed to repair and redesign a bone to its original shape. The surgery is used to treat bone deformation in various joints of the body. Example of this is the femoral osteoplasty. It is the surgical alteration or reshaping of your femur, which is your thigh bone. It is performed if you have an abnormally shaped femoral head or neck leading to a medical condition called femoral acetabular impingement or the FAI, the most common cause of hip pain. Your hip is a ball and socket joint where the ball-like top of the thigh bone or the femoral head fits into a cup-like socket in such a way that the ball can move smoothly within the socket. Sometimes, an extra bone grows on the ball of the joint, giving it an irregular shape. There are two types of osteoplasty: arthroscopic osteoplasty and the open osteoplasty. Arthroscopic osteoplasty is a minimally invasive option and usually the preferred approach. And the open osteoplasty is the approach, a more invasive procedure and the least preferred type. However, the type of osteoplasty depends on the severity and location of the abnormality. During the arthroscopic osteoplasty, a small incision is made in the skin covering the affected hip joint. The arthroscope is then guided into the affected area in the joint. The third one is the hip is pulled apart slightly and the exact spot of the abnormality is identified. Next is the access bone spur is removed using a shaver or a radiothermal device. If the condition is more severe or in an area that cannot be reached by arthroscopy, your doctor will OPT for open osteoplasty. During open osteoplasty, an incision large area, an incision large enough to access that affected hip joint is made in the skin. The hip is dislocated and the bone spurs are removed under direct visualization. The incision in the skin is sutured and an appropriate dressing is applied.
First is we have prosthesis. It is an artificial organ or part such as an artificial limb. To elaborate, a prosthesis is a specialized medical device that serves as an artificial replacement for a missing or non-functional part of the human body. Prostheses are created to address various needs, whether it's restoring lost function or enhancing the aesthetics of the replaced body part, while the most common association is with artificial limbs. Prostheses can encompass a wide range of devices including joints, organs, teeth, and many more. The primary goals of prostheses are to improve the overall quality of life and functionality for individuals who have lost or are born without specific body parts. These devices can significantly enhance mobility and independence, allowing people to perform daily activities more comfortably. Additionally, prostheses are often customized to fit the individual's unique anatomy, ensuring optimal performance and comfort. Prosthetic technology has advanced significantly in recent years, incorporating lightweight and durable materials like carbon fiber, computerized components, and advanced design to create highly functional and realistic prostheses. This evolution in technology not only enhances the function of the device, but also pays attention to the aesthetics, making prostheses appear as natural as possible. In addition to external prosthetic limbs, there are also internal prosthetic devices. For example, artificial heart valves are a type of prosthetic used to replace a malfunctioning natural heart valve, enhancing cardiovascular health and prolonging life. It is important to note that people who receive prostheses often require rehabilitation and training to learn how to use the device frequently and effectively and adapt to their new abilities. As a result, prostheses represent a critical aspect of medical advancements, offering individuals who have lost body parts an opportunity to regain function and improve their overall well-being.
Before I start my discussion, I would like to introduce myself. My name is Sanja M. Pedrad, and I'll be the one to discuss with you some other treatment. Okay, let's start. Alkaline phosphasis or ALP. When we say alkaline phosphasis, it is an enzyme needed in the formation of bone serum activity of this enzyme is useful in diagnosis. The alkaline phosphasis is an important serum analyte and its elevation in serum correlated with presence of bone, liver, and other diseases. The alkaline phosphasis enzyme is present in many parts of the body, but it is primarily found in the bones, liver, intestine, and kidneys. Alkaline phosphasis is an enzyme in blood that helps break down proteins. An ALP test measures how ALP is circulating in the bloodstream. Having a high or low ALP levels can indicate an underlying condition. ALP levels are abnormal could indicate a number of health issues, including liver issues, bone disorders, some types of cancer, and other diseases. Usually, the underlying illness is slightly elevated. ALP levels might arise spontaneously. Serious medical issues, usually involving liver, bones, or kidneys, might also be indicated by abnormal levels. Though, there are also harmless causes of abnormal levels, such as pregnancy or bone development in children and adolescents.
Arthrocentesis, aspiration of fluid from joint by needle puncture. Arthrocentesis, commonly known as joint aspiration, is a medical procedure that involves the removal of synovial fluid from a joint using a needle and syringe. This procedure is often performed to diagnose and treat various joint conditions, such as arthritis or infection. It allows healthcare professionals to analyze the synovial fluid for signs of inflammation, infection, or other issues. Additionally, arthrocentesis can provide relief to patients by reducing pains and swelling in the affected joint. Arthrodesis, surgical immobilization or fusion of a joint artificial ankylosis. Arthrodesis is also known as synesis or artificial ankylosis. It is also commonly referred to as joint fusion. It is a surgical procedure that involves fusing of two or more bones in a joint together, typically to treat joint conditions or severe arthritis. The goal is to create a stable, immobile joint by promoting the fusion of the adjacent bones. This can help relieve pain and improve joint stability but sacrifices joint mobility. Arthrodesis is usually considered when other treatments such as physical therapy or medication have not been successful in managing joint problems. Arthroplasty, partial or total replacement of a joint with a prosthesis. Arthroplasty is a surgical procedure in which a damaged or diseased joint is replaced with an artificial joint called a prosthesis, often made of metal, plastic, or combination of materials. The most common type of arthroplasty is total joint replacement, where both the bone ends of the joint are replaced. This procedure is often performed to relieve pain, improve joint function, and enhance the quality of life for individuals with conditions like osteoarthritis, rheumatoid arthritis, or joint injuries. Arthroplasty can be done on various joints including the knee, hip, shoulder, and more.
Good day, everyone. I am Johan Casey Ibalubal, and I will be representing one of the three other treatments of medical terminologies related to the skeletal system. We have arthroscopy. Arthroscopy is use of an endoscope to examine the interior of a joint or to perform surgery on the joint. The instrument used is arthroscope. What does an arthroscopy do? It allows the surgeon to see inside your joint without making a large incision. So, when do you need an arthroscopy? You need an arthroscopy to diagnose and treat problems that damage the articular cartilage, ligaments, and other structures around the joint. Why it's done? Doctors use arthroscopy to help diagnose and treat a variety of joint conditions, most commonly those affecting the knee, shoulder, elbow, ankle, hip, and wrist. There are surgical procedures. Its conditions treated with arthroscopy include loose bone fragments, damaged or torn cartilage, inflamed joint linings, torn ligaments, scarring within the joints. Dissectomy. Dissectomy is a surgical removal or herniated intervertebral disc, also spelled dissectomy. Dissectomy works best for treating pain that travels down the arms or legs from a compressed nerve. Why it's done? To relieve the pressure a herniated disc places on a spinal nerve. What is a herniated disc? A herniated disc occurs when some of the softer material inside the disc pushes out through a crack in the outer lining of the disc. A healthcare provider might recommend dissectomy if nerve weakness causes trouble standing or walking. Conservative treatments such as physical therapy or steroid injections fails to improve symptoms after 6 to 12 weeks. Pain travels into the buttocks, legs, arms, or chest and becomes too much to manage. Orthopedics. It is the study of treatment of disorders of the skeleton, muscle, and associated structures, literally straight means ortho and child means ped, also spelled orthopedics. Orthopedics is a branch of medicine that focuses on the care of the skeletal system and its interconnecting parts. It includes bones, muscles, joints, tendons, ligaments, and nerves. There are generally two types of orthopedists. We have the surgical and non-surgical. The former are called orthopedic surgeons, while non-surgical orthopedists include physiatrists and physical medicine and rehabilitation specialists.
Hello everyone, my name is Chris Alfred Q. de Guzman. So I'm gonna discuss to you the reduction of the fracture. What is reduction of the fracture? This is the return of the fractured bone to normal position. There is two types of surgery. This is the close and open. What is the close? Close is the not requiring surgery and the open is requiring surgery. So I'm gonna give you some explanation. So The doctor will push or pull the end of the fractured bone until they line up. This part of the procedure is called reduction. Then your doctor will put a cast or splint on the affected arm or leg. So what is the cast or splint? This is the metal they use to connect your fractured bone. So what is the benefit of putting cast or splint? Is to help hold the bone in place while it heals. So that's the use of cast or splint. The doctor will take an X-ray to check that the bone is properly lined up. So why they need to use X-ray? Because they cannot see the fractured bone, so they use the X-ray to check that the bone is properly lined up. I'm gonna tackle also about traction. What is traction? The process of drawing or pulling sac traction of the head in the treatment of injuries to the cervical vertebrae. What is the purpose of traction? Is to regain normal length and alignment of involved bone, lessen or eliminate muscle spasm, relieve pressure on nerves, and especially in spinal nerves. We can see this traction mostly in the victim of car accident, motorcycle accident. The help of traction is to help the cervical vertebrae heals. So that's all about the reduction of the fracture and reduction. Thank you for listening.